Hi, my name is Hela from Free Spirit Yoga. Today's session is all about box breathing. We're going to be talking about the benefits, the contraindications, how to do it, and towards the end of the video, we'll actually do a few rounds together. So if this information is already known to you, you can always skip to the end of the video using the chapters in the description. So what is box breathing? Box breathing is one of my favorite breathing techniques. It is so simple, yet very effective. Some of the benefits are physical and some of them are emotional. For the physical benefits, we're working with our cardiovascular system. So we're lowering the heart rate down and we're regulating our blood pressure. We're also working with our lungs, increasing our lung capacity and efficiency. And it's also great for pain management. Some of the emotional benefits include improving mood, bringing a sense of grounding, bringing clarity and focus, and also it is wonderful and very effective in reducing stress and anxiety. It is so effective in reducing stress and anxiety that the US military uses it with its soldiers. In the US military, it's called combat breathing or tactical breathing, and they use it both for training purposes as well as during the very stressful operations that the soldiers undertake. So when the soldiers are in very stressful situations, what they do is they take this box breathing in order to take them out from the fight-flight response. It maintains their composure, it brings them emotional balance, it increases their cognitive ability, and finally, it also improves their physical endurance and ability. So what are some of the contraindications for box breathing? Who are the people who should avoid box breathing? Pregnancy. It's important to check with your doctor. People who have vision issues, for example, a detached retina or glaucoma. If you recently had surgery or if you have open wounds that haven't healed yet. If you have mental disorders such as schizophrenia or bipolar disorder, you want to be sure to check with your practitioner, as well as any major heart issues. So in these situations, you want to be sure to check with your healthcare provider to make sure that any kind of breath work, and specifically box breathing, is okay for you. During the practice, if you ever feel dizzy, lightheaded, blurred vision, racing heartbeat, or chest pains, you want to be sure to stop the practice. So how do we do box breathing? We're going to imagine a box with 4 sides. So we're going to inhale for 4 counts, hold for 4 counts, exhale for 4 counts, and then once again hold for 4 counts. During this time, all our breathing is done through the nose. So you breathe in through the nose and out through the nose, and your lips are closed. So during the breath work, we're going to imagine this box shape in our minds, and we inhale, hold, exhale, hold to keep the rhythm going and we don't lose track. You can also use your fingers. You can count with your fingers, or you can count internally. All of this is designed to bring more focus to your breath work. So let's give this a try. We're going to start off with a cleansing breath. That means you're going to take a breath in and a breath out, and then we'll do 1 round of box breathing, and we'll see how we feel, and then we'll go and do 4 rounds of box breathing together. So coming into a comfortable seated position, I'm sitting on a block. You can sit cross-legged if you like. You can sit on a thick book. You can sit on some folded blankets, or you can sit directly onto the floor. If you prefer to do it sitting on your heels, you can do that as well. You want to straighten your spine, open up your chest, and drop your shoulders down. You can either look at the tip of your nose, softening your gaze, or close your eyes. And as mentioned, we're going to take a cleansing breath. So breathe in through the nose and out through the nose. And now inhale for 4, 3, 2, 1. Hold for 4, 3, 2, 1. Exhale, 4, 3, 2, 1. And finally, hold for 4, 3, 2, 1. Release your breath and notice how you feel. Hopefully that brought a little bit of calm to you. And if you feel okay, if you don't feel lightheaded, we'll go ahead and take 4 rounds together. Now, box breathing can be practiced anytime during the day. You can do it in the morning, when you wake up. You can do it in the evening before you sleep. You can do it right before a stressful situation. For example, if you're going into a meeting with your boss, or you have a presentation, or you're about to do some public speaking. Even if you're about to meet a friend and there's a very tough topic that you'd like to discuss and you're feeling nervous and your heart is racing, just taking a few rounds like this, nobody can even tell that you're doing some breathing techniques because you're doing it in through the nose and out through the nose. All right, so let's get started. So once again, come into your comfortable seated position, softening your gaze or closing your eyes, placing your hands on your knees, either palms facing down or facing up. And we'll start with a cleansing breath. Breathe in and breathe out. And now inhale for 4, 3, 2, 1. Hold 4, 3, 2, 1. Exhale 4, 3, 2, 1. Hold for 4, 3, 2, 1. Round 2. Inhale for 4. Hold for 4. Exhale for 4. Hold for 4. Round 3, inhale for 4. Hold for 4. Exhale 4. And hold for 4. Last round, inhale for 4. Hold for 4. Exhale for 4. Hold for 4. Release your breath. Come back to your normal rhythm of breathing. You can keep your eyes closed just for the last few moments as you enjoy the benefits of box breathing. Noticing if you feel calmer, more grounded. And now slowly opening up your eyes. I hope you enjoyed the information about box breathing, and I hope you'll use this as a tool. I'd like for the information to be practical, that you can use it throughout your day. So if you're driving and somebody is like annoying you, or you're stuck at a traffic light, take a few rounds of box breathing and notice how it brings a little bit of calm and peacefulness into your day. Thank you very much, and I hope to see you on the mat.